Thank you for joining us again today for another educational video about fibroids today. I'm Dr. Scott Whitten at the Nevada Center for Reproductive Medicine. I'm going to talk to you about fibroids and everything you want to know about fibroids, how common they are, how we treat them, and what their impact is on one's reproductive potential. So fibroids are quite common. We see them in all ethnic groups. It does occur a little bit more commonly in populations like the African American population, but we see them in all groups, including Caucasians, Europeans, Hispanics, all groups alike. Now, a lot of patients don't know they have fibroids because a lot of times they're asymptomatic from them. It means they're not having any symptoms of pressure or bleeding or infertility issues. So they don't even know they have them until they come see us, and then we discover them. Some patients are actually referred to us because of their fibroids. They were discovered by another provider, or they are causing symptoms. But initially, what you do when you evaluate for fibroids is you do something simple like an ultrasound of the pelvis. And the ultrasound is a great tool to determine where fibroids are, how big they are, and their location, most important. Because it's really those two things will then determine whether the fibroids are going to impact your reproductive potential. Now, fibroids come from the uterine muscle. They're called myometrial cells. And when a myometrial cell in the muscle wall starts to replicate itself more rapidly than the rest of the uterus, it forms these rubbery white balls of tissue. And that's what fibroids are. And I don't know if you can see this or not on this diagram here, but this shows you a uterus that's full of fibroids. And we call the fibroids by different terms based upon their locations, such as this fibroid that's inside the cavity of the uterus is an intracavitary or subserosal or a submucosal fibroid. Fibroids that occur towards the outside are called subserosal. I know the terms sound a lot alike. And then you have fibroids that are in the muscle wall called intramural or through the wall, and then some that are actually hanging off the top of the uterus or on the outside, which are called pedunculated, meaning they have a stalk on them. So where that fibroid is and the size of the fibroid really is going to determine its impact on one's reproductive potential or symptoms. I've seen patients where they have fibroids all throughout their pelvis, and none of them were in a location that caused any problems. And then I've also seen patients where they had one fibroid, and the fibroid was in the wrong location, say right in the middle of the uterus where a baby's supposed to be growing, and they have bleeding problems from that and cramps. So when you discover fibroids, if it's warranted that the fibroids are in locations where they're going to cause problems for us, then we start talking about treatments. And there's really two methods to treat fibroids. One would be a medication, which is unfortunately only temporary, and it only causes shrinkage of fibroids, but doesn't cause them to go away completely. And then the other form of treatment is surgical management. And surgery, the approach of the surgical treatment really depends upon where the fibroid's located. For example, if a fibroid is inside the cavity of the uterus, then you can use a hysteroscope or camera in the uterus that goes in here, and you can shave out the fibroid and take it out that way. So no incisions on the abdomen. You also might have fibroids that are all throughout the uterine muscle, and that has to be approached from an abdominal approach, where we have to actually make an incision into your tummy, and you have to stay overnight in the hospital, usually to remove all those fibroids. But the objective of the surgery, regardless of which surgery you're doing, is to restore the anatomy back to normal so it will function normally for us and have the least impact adversely on our reproductive potential. If you guys have any more questions about fibroids, if you've been diagnosed with fibroids, we're happy to provide you with some additional information. Please just call our office, Nevada Center for Reproductive Medicine. We're happy to help.